Yeah, please, happy to. Yesterday, our board of directors approved, as you mentioned, a $450 million loan to PT Bio Farma. It's a 5-year loan with a 2-year grace period, 3-year repayment period, and the pricing is LIBOR plus 50. The loan is focused on what we consider the single most important priority for countries right now, and that is to help Indonesia procure safe and effective vaccines that are absolutely essential to bring an end to this prolonged and terrible pandemic. We expect our $450 million to help secure 65 million doses. That's about 15% of the government's 430 million dose target. And the loan will also provide additional capital for ADB to help work with Bio Farma on strengthening its logistics capacity. As you know, merely getting the vaccines isn't enough. We have to deliver them effectively. And I do want to say on this note that Indonesia really has become a leader, particularly amongst middle-income and developing countries in terms of vaccine security. Many countries do not have a national champion like Bio Farma. And so from ADB's perspective, it was a welcome opportunity to extend this financing to Bio Farma and in so doing to extend our collaboration with the government of Indonesia in response to the COVID-19 pandemic.
And Ahmed, earlier, about April 2020, we have also Asia Pacific Disaster Response Fund. It is about $3 million. What should we understand about this? It's already agreed upon to help also the Health Minister of Indonesian Republic.
Yeah, absolutely. We both had the APDRF, which you referenced, which was used to immediately procure needed PPE and other equipment. But in addition, I would also mention last year, we provided $1.5 billion in budget support in order to support the government's fiscal response program, the $47 billion PEN Economic Recovery Program. And so our engagement with the government of Indonesia has begun from very early in this crisis. There have been a few different ways that we've worked together, not just in terms of lending financing, but also in terms of engaging in the design of programs, ensuring that those most needy are included within the social safety net. So I would say that while COVID-19 has been a terrible crisis, it's certainly been an opportunity for us to deepen the relationship between our institution and the government of Indonesia.
Tell us more about responsive COVID-19 vaccines for recovery or recover. You are funding at least about 65 million doses of vaccines for the prioritized country. What should we understand more about this? How is it progressing so far, this program by ADB?
Well, I think we're just at the beginning of this specific initiative, which is to help Indonesia procure, as you mentioned, 65 million doses. But the government, I think, has done a good job already on the vaccine front. It's been incredibly impressive. As you know, Indonesia was the first ASEAN country to procure vaccines. It's been the first developing country from Asia to roll out vaccines. It's been really impressive to see the work done by the Department of Health, the Ministry of Health, in terms of accelerating daily vaccinations. So I think that there's quite a bit of good work that's gone on already and that we can build on with this financing.